Hey everybody, it's Susan Lindner. I'm back. I'm your host of the Innovation Storyteller Show. And today's special because we have another highly esteemed member of MIT's list of the most innovative thinkers, young thinkers, actually under 35 in the world today. And I'm just elated to be joined by Alex Abramson, who is an assistant professor of chemical and biomolecular engineering at Georgia Tech. He is developing ingestible, implantable, and wearable robotic therapeutic devices that solve key healthcare problems and provide measurable therapeutic outcomes. So some of these examples include pills that can replace insulin injections and patches that can even track cancer regression in real time. So we're going to be talking to Alex today about how we're shifting and rapidly innovating this world around how we're taking really important drugs, how we're tracking different diseases, and what the future looks like of healthcare in a way that maybe some of us haven't thought of before. So Alex, thank you so much for joining me today. This is such a treat.
Yeah, thank you so much for having me. And I'm really happy to be here.
And congrats on getting on one of the most prestigious lists in the world. How does that feel?
It's very exciting. I'm really appreciative of MIT Technology Review and the way that they have covered some of my research.
Well, it's just phenomenal. And why not, right? When we are thinking about the millions, maybe hundreds of millions of people around the world who are using insulin, whether it's pump, whether it's injectables, some are even taking pills, but we're looking at completely different ways, right? Your research is looking at completely different ways of how we'll be looking at insulin, as well as many other therapies in the future in a way that we haven't before. And we're looking at a field of like ingestibles and wearables, and it's kind of like the age of robots moving one step closer to the human body, right?
Yeah, it really is. We're at a point in time where a lot of the electronics and fabrication methods have advanced to the point where we don't just have to think about them in terms of computers, but we can actually think about them in terms of putting them on our body and even inside of our body.
Yeah. So Alex, you're a little kid, right? And you're thinking about all of these, and you're thinking about things that excite you as a little kid, about what's really intriguing and engaging. Like, when did this all start for you to get interested in this kind of work? And what predated that even, maybe?
Yeah, well, I've always liked tinkering and science, even from a very young age. But I didn't know that I wanted to do research, and specifically biomedical research, until I got to college. And I had my first opportunity to do academic research and work on a problem that had never been worked on before. And so one of the first experiences that I had was creating these microfabricated grippers that, when they were released inside of the small intestine, they would close around the tissue wall of the small intestine and collect biopsy samples. So a person could get hundreds of biopsy samples instead of just the dozen or so that you would get if you had a traditional endoscopy.
Wait, hold on for a sec. So you're always a little kid and you're tinkering, right? And then you get to college. And what did you wind up studying in college that led you there?
Yeah, so I studied chemical engineering, and the professor who I was working with during my bachelor's degree at Johns Hopkins was Professor David Gracias. And so he's an expert in this field of microfabricated devices and their abilities to self-fold. And so you create a two-dimensional system, and when it's put in the body, it actually folds itself up into a three-dimensional gripper, and it's able to grasp on to any sort of tissue inside of the body. So that was really my first.
Make this visual for me. I'm conceiving of a small origami kind of folded device almost that I'm swallowing. And then it hits my small intestine and pa-pam, it's like a transformer, and it opens. And suddenly I have this little gripping arm. How does it know what to grip, Alex?
Well, so it's kind of like that, but imagine it being much smaller. Each of these grippers is a six-pointed star, but it's less than a millimeter in. And so it starts off as this two-dimensional sheet where you see the star, but when it reaches body temperature, which is about 37 degrees Celsius, it activates and it closes around the tissue. And so that all those 6 points of the star close and it makes something very close to a sphere. And then inside of that sphere would be the piece of tissue that you've collected.
So it's like a Chinese throwing star that's flat, but it's only a millimeter. It hits body temperature. It then turns into like a sphere that chomps on, it latches onto the intestinal wall. And how does it know what to biopsy as opposed to all of the small intestine?
So this is actually for statistical biopsy sampling. So when you're not sure what the best area to look for a cancer is, or a particular type of disease, you want to take random biopsy samples. And so this just takes hundreds of random biopsy samples, and that can be collected and gets a much better distribution of the tissue than just looking if you were a normal doctor and taking specific samples around the gut.
And how do these leave the body?
So they're collected via a magnet and then they're passed through the body.
No way. So you pick up all these little paper clips, essentially, right? If you go back to like those little iron shavings that we used to make faces with, but like you're applying a magnet and that's through the esophagus and into the body, or is it, how does that happen?
Yeah, so there's a couple of different ways that it can be delivered. It could be delivered during an endoscopy, but there also have been pills that have been developed to actually deliver those micro grippers and then collect them again.
Shut up. That is incredible. That is so mind-blowing, Alex.
Yeah, so that was my first experience in the field of GI devices, gastrointestinal devices.
I don't know how many undergrads have had an experience of that kind of experimentation, that kind of visionary thinking. I think we heard about swallowing cameras. I can still remember that when I was in my 20s. So that was 30 years ago. But the thought of now having these diagnostic tools that are capable of doing that be collected again. And what kind of results were you getting?
So a lot of this was really at the device design stage. So we were doing some experiments in large animal models and also on ex vivo tissue. I don't think that this particular project ever reached human clinical trials, but it's in the process of getting there.
Wow. Wow. And, we have to like take our hats off and remember how long it takes for these brilliant ideas to actually get to market, right? Because the levels of scrutiny and the levels of safety is nothing like, putting out a new Tesla, right? And, which, not to mention not a short period of time either, but certainly the lengths we go to protect patients is also important. So, okay, so you do this amazing research at Johns Hopkins, these Chinese throwing stars that turn into grippers, they get sucked out by a magnet, just it's like the stuff of science fiction, amazing. And then you move on to your next level of research. And so tell us what happened next.
Yeah, so then I moved to MIT and I worked with professors Robert Langer and Giovanni Traverso on this project for creating a new method to orally deliver insulin and other macromolecule drugs like Humira or mRNA via this pill rather than an injection. So traditionally, macromolecules like insulin need to be injected rather than ingested because they're much larger than small molecule drugs like aspirin, and therefore they can't pass through the tissue wall of the gastrointestinal tract and be absorbed into the bloodstream. It takes an extremely long time for these very large molecules to pass through the tight junctions inside of the tissue. And then on top of that, there are a bunch of enzymes present in the stomach and in the small intestine, which rapidly degrade these macromolecules. So by the time that they actually would reach into the bloodstream, they would have already been degraded. What we did was create a pill that bypasses the need for diffusion through that tissue wall and instead takes a small microneedle and injects drug directly into that vascularized layer of tissue, allowing for an immediate uptake of that drug into the bloodstream. But what was really difficult when we were creating that pill was figuring out how we were going to miniaturize this injection system into a pill, but also make sure that when that injection system was activated, it was delivering into the tissue wall and not into the lumen of the gastrointestinal tract and that fluid that has all those degradative enzymes. So what we did was we created this self-orienting pill, which we call the Soma System for short, which stands for the self-orienting millimeter scale applicator, which is able to, after ingestion, orient itself in the stomach so that microneedle actuator is always facing towards the tissue wall.
Okay. So you have, and I'm just swallowing this pill, is you have a self-navigating injector system that's able to bypass the harsh acids, stomach acids, right? All those harsh chemicals that our body naturally produces to break down really important things, right? So that they don't get into other parts of the body, and really dive right into the wall of, is it the stomach or is it the intestine? Where is it going?
So we've developed pills to inject into both the stomach or the intestine, but the one that I was talking about previously is specifically for the stomach. And I can give you a little bit of a timeline of what happens when you
Yeah, walk us through it. Walk us through it.
Yeah, so imagine you have a pill and you pop it out of the package. That package is humidity sensitive, so no humidity is able to enter into that package. You then swallow it, and immediately the pill has access to hydration, right? Your entire body has 100% humidity and there's fluids all around. And that starts on the pill. And so once that pill sees hydration, 4.5 minutes later, it's going to have its injection mechanism be activated. That 4.5 minutes gives it enough time for it to pass through the esophagus. That typically takes anywhere from 20 seconds to a minute. Then it lands in the stomach, and within a millisecond, it's oriented itself and is facing towards the tissue wall. We then give it about 3 more minutes of leeway, just in case the person, takes a little bit of time to swallow that particular pill. And the hydration triggered actuation mechanism then inserts that drug into the tissue wall. And the microneedle that we're using, we can either deliver a liquid formulation, which would use a metal microneedle, which is then retracted back into the pill and allows the pill to pass through the body and be excreted. Or we can deliver a solid formulation where that microneedle is actually made of drug itself. So the microneedle dissolves inside of the gastrointestinal tissue.
It's like edible cutlery at that point, right? I mean, like you don't even have to fish out the microneedle anymore. And when we say microneedle, I mean, how big is this microneedle?
Yeah, so we're talking about 500 microns in diameter up to about 900 microns in diameter.
Oh, so nearly invisible, right? If you're holding it in your hand, it's tiny.
It's extremely small. And what's really important is that the stomach doesn't have the same pain receptors that the skin has. And so when you get a traditional injection through the skin, it's going very deep into the tissue and it hurts because it's hitting a lot of those nerves that have pain receptors. In the stomach, though, you don't sense pain in the same way. You could possibly sense pain if your stomach is expanding quite a bit. Imagine you eat a really big meal and your stomach has expanded. You feel that kind of pain, but you don't feel acute pain. Imagine when you eat a big piece of steak that you haven't chewed quite enough, right? You feel it as it passes through your esophagus, but you never really feel it land in your stomach. And so in the same way, this microneedle injection doesn't have any feeling associated with it.
So, and then it can deliver the proper dosage, right? It doesn't have the ability to determine the dose that you need. You determine that before you swallow it.
Yeah, so you determine it before you swallow it, but it can deliver quite a bit of drug. We can deliver up to 4 milligrams of drug and then anywhere down to as small as micrograms of drug. So anywhere, in the range that would be needed for a lot of these macromolecules. To give you an idea, like what the traditional doses are, for insulin, you could be dosing anywhere as small as 50 micrograms of drug and anywhere as high as 2 milligrams of drug.
So how did this idea come to mind, Alex? Can you give us a little bit of background on how the idea, tell us about the ideation before you even got to prototype? What was happening?
Sure. So what we were thinking about was how were we able to bypass this need for diffusion? For 100 years, scientists and healthcare professionals have been trying to increase the rate of diffusion of these drugs through the tissue wall. But the best they were able to get was 1% of the drug that a person was ingesting was able to then be taken up by the body into the bloodstream, which makes it not practical in a cost-effective way. If you think about only delivering 1% of the drug that you're ingesting. What we were trying to do was create a way that we could deliver 80% or even more of that ingested drug into the bloodstream. And the only way we thought to do that was to actually come up with a new way of delivering that drug rather than diffusion, having an injection of that drug immediately into that important layer of tissue that has the vasculature needed to take it up into the body. The other thing that was really an exciting part of the project was figuring out a way to orient that pill inside of the stomach. And so we did a lot of research in this area, and I found a mathematician in Hungary, and he is specifically focused his entire career on self-orienting objects. So this guy, Professor Domakov, he created one of the famous shapes called the gombak, which is a shape.
Oh, sure, the gombak, absolutely. Help us out, Alex. What's a gombak?
So a gombak, if you look it up online, you'll be able to see exactly what the shape is, but it has the same density throughout the entirety of its shape and its object, but it's able to orient itself regardless of how you place it initially on a surface. And it looks a lot like a turtle shell or a tortoise shell. And so this professor, he also did quite a bit of research on the self-orienting nature of turtles and tortoises. And the leopard tortoise in particular, he saw was able to orient most quickly on land compared to any other type of turtle or tortoise. And it had to do with the density distribution of the tortoise shell and also the shape of that tortoise shell. So what we did with our pill was we took the initial guess of that tortoise shell shape that the professor in Hungary had come up with as an ideal shape for self-orienting. And then we optimized it for specifically orienting in the stomach. So the stomach has a bit slicker walls compared to a traditional land environment. It also has folds inside of it, and the stomach also churns quite a bit. And so we wanted to make sure was just as a leopard tortoise doesn't want to be pushed over by a predator, we also wanted to make sure that our system, when the stomach was churning, didn't turn itself over and instead always maintained its configuration where that injection mechanism was facing towards the tissue wall. So just like a tortoise, our injection mechanism and the entire shape of it has a flat bottom, which prevents it from being tipped over once it's reached a stable configuration. But it also has a curved and pointed top, which destabilizes every other type of orientation that pill might land on. It also has a weighted bottom, which is really important, similar to a leopard tortoise, where the bottom of that shell is very thick and most of the meat of the tortoise is much lower to the ground. That lowers its center of mass. And so our shape also has a very low center of mass, very close to that stable configuration, which allows it to easily flip over based on angular kinematic equations.
So when this hits the market, I understand you'll be having leopard tortoise soup as your celebratory meal.
The leopard tortoise is actually endangered.
No, don't do that, listening audience. Do not go out and make yourself leopard tortoise soup. Do not.
But I did have a chance to go see the leopard tortoise in its natural environment in South Africa. I made it a point to go to South Africa and see the leopard tortoise myself and look at it in its traditional environment.
And did you see it flip and turn and right itself again?
I didn't myself take a tortoise and tip it over, but there were a lot of leopard tortoise shells that have been found, quite a bit. And so I took pictures of those and I analyzed their density distributions.
Fascinating. So, and I just, one of your other MIT Tech Review list makers was on our show. And we were talking about the inspiration of nature in robotics. She had developed a robot that was self-extending. So the same way a seed, and its sapling might push through the soil and grow, they need robots that grow inside of another organism or entity, or in her case, an archaeological dig where the robot had to push through these tiny vents in underground homes in an archaeological dig in Peru. And, it was that, or, if you think about it, even from an oil rig or a tube where an arm has to extend naturally in order to undo a blockage, let's say, or to push something through a particular tube. it has to continue to extend long beyond, and it's more than an antenna, it's a growing process. So it's, I guess I had always seen the majority of robotics that we relate to on television, Boston Robotics, right? And everything, and Boston Dynamics rather, that are creating their like dogs and things like that. We do take our inspiration so much from nature, right? And oftentimes from other humans, I think is how we see robots. But what we have to learn from mathematics and the animal kingdom or even plants is vast if we stop for a minute, right?
Absolutely. Yeah. The amount of engineering knowledge that you can gain from nature is incredible. And there are just hundreds, if not thousands, of examples of ways that we as scientists and engineers have learned from nature to help inform some of our device design.
Right. So advice from Alex Abramson: if you need inspiration for your latest robotics creation, get the hell out of the lab and go walk around in a forest, right? Go walk around in a natural habitat and see what answers await you there. So fascinating, but still not without its challenges, right? I mean, we're talking about a self-orienting swallowed device that has a lot of hurdles to overcome in the approvals process and the clinical trials process. So tell us about some of the bumps along the way, Alex. What's the hardest? What are some of the hard bumps you've had to face already?
Yeah, so the pathway from ideation to human trials is a very long. So we began this project in creating initial prototypes in early 2016, published our first paper in 2019, and reached clinical trials just a couple of months ago in mid-2022. And so during that time, we've had quite a few different hurdles. Definitely the hardest one is going from those large animal models into human clinical trials.
And what were the animals you used, just out of curiosity, to get started?
Yeah, so in these particular experiments, we use animal models that have the closest relation to the human gastrointestinal tract. So that would be swine and dogs.
Mm. And so tell us a little bit about those approval processes. What needed to happen next, or what were some of the challenges in the approval process?
Yeah, so one of the things that you need to do is make sure that you can create this device in aseptic conditions, meaning that you're able to create a system that's completely clean and easily able to be ingested without having a fear of giving an infection to the person who you're delivering that drug to. The other thing that is really important is when you're making those initial designs and prototypes in the lab, that you're thinking about the ability to mass manufacture these devices, because you don't want a device entering clinical trials that can't be mass manufactured. You lock in that device design when you start the clinical trials, and you need to make sure that you can make millions of those pills. So when you're thinking about doing an initial design and you're working with 3D printers, or you're hand molding and crafting those systems, but then you're moving to later stage types of manufacturing type techniques, such as injection molding, you want to make sure that those designs are compatible, and the materials that you're using in those early stage designs are also compatible with those mass manufacturing techniques, but are also biocompatible for human usage.
Mm. Yeah, and almost every research entity has an internal review board, or an IRB. So did you get some initial pushback from the IRB, or had they seen these kinds of experiments before?
One of the ways to make sure that your device is ready to move into humans is to do a lot of these large animal trials. And so we've actually tested the device in somewhere close to 100 different animals for each of those animal model types. And we've done it not only with insulin, but we've tested with a lot of different drugs, including GLP-1 receptor agonists, adalimumab. A GLP-1 receptor agonist is a diabetes drug.
Okay.
And then adalimumab, which is widely known as Humira. So that's a drug for different types of inflammatory diseases. That's a monoclonal antibody. And then we've also tested it with epinephrine, which is a slightly smaller molecule, traditionally used in the EpiPen. And we've tested it for mRNA nanoparticles as well. So being able to show that this system works with a variety of drugs and then also has a very rigorous safety profile being done in those large animal models helps us to mitigate the risk as we move to humans.
So I'm curious, so you've moved into human trials now, right, Alex?
Yes.
And how did that first explanation go about, a kind of self-injecting swallowable device, right? How did patients first respond?
So I personally was not there
Uh-huh.
while these patients were taking the drug. But what's really important is that there's a physician there who is monitoring them and taking care of them. And one of the things that is important is to have visualization of the device as it's going through those particular steps.
How do you do that? You just paint it fluorescent green, or how does that work? How are you visualizing it?
Yeah, so we have a lot of different ways of visualizing this system. One of the ways is actually through an endoscope. So you can actually get a camera on the system. You can also visualize it through fluoroscopy or x-rays because the device has some metal components to it. So that allows us to view it through the body through x-ray as well.
And how long does it stay in the system before it's passed?
So that depends on which particular animal model or human you're talking about. And there's also variation from being to being. But in swine, they have a slightly longer time for gastric transit. So and in dogs, they have a much shorter time for gastric transit. And humans lie somewhere in between. So that's one of the things that we're looking at specifically for humans is how quickly it would pass through the gastrointestinal tract. For swine, it would take on the order of a couple of days. For dogs, it took around 24 hours or less to pass through the gastrointestinal tract. And so for humans, we expect it to be somewhere in between. So traditionally, you can imagine if you were to eat corn, for example, that takes about 24 to 36 hours, and you can visualize it as it's coming out the other side. And so that would be very similar for this type because it includes some non-degradable pieces to it.
And so can a patient take more than one of these a day, given the need for their own insulin?
So we've tested multiple pills being dosed at the same time in these animal models. That's not necessarily something that we plan on doing immediately with the humans. Right now, we're just looking specifically at a lot of the safety profiles of delivering one device, potentially what would happen if you delivered the same device every single day for a long period of time. What are the safety concerns associated with this type of delivery?
So all still TBD, but I think for so many of us on the outside looking in at this kind of medical research, it seems like the cost is exorbitant. And so how do you fund this kind of research, given that you're doing experiments on, on animals, now on humans? How long have you been working on this, Alex? And what's the cost?
Yeah, so the cost is quite a bit, and it's really important to get funding from sources that care deeply about the problem that you're working with. And so Novo Nordisk has been a big contributor to a lot of the research funding, and they've actually licensed the technology and are bringing it into human trials themselves. So they're the ones in charge of these clinical trials. I'm a scientific advisor for Novo on these clinical. So they've been a really great supporter, not just in terms of money, but also in terms of time. So they have a lot of people in their company who have helped quite a bit on this project ever since the inception of some of the ideas. And they're actually co-authors and co-inventors on the papers and patents associated with some of this work.
Wow. And so when do you anticipate this hitting the market?
That is a good question. And, part of it has to do with, how the clinical trials progress. We want to make sure that when it reaches the market, that it is both safe and effective.
Of course. We want to be as cautious as possible, especially when we're doing this kind of breakthrough research. But is there a time horizon that you can foresee?
Well, I can't say specifically what the time horizon would be, but for this device, but for devices that are, in a similar area, so medical devices that are drug device combinations, those require looking not only at the safety of the device, but also the efficacy of the drug and its new delivery modality. And so that means slightly more clinical trials are required aside from just a normal medical device.
For sure. Well, I mean, just fantastic. And, just thinking about how we'll do this in the future. And, I just have one more side question about wearables. Is there a tie-in between like a wearable pump or a wearable monitor in conjunction with these swallowable devices?
Yeah, so right now, the systems that are in clinical trials are completely mechanical. There's no electronics associated with them, which is really exciting because it brings down the cost and the complexity quite a bit. But
Mm.
we're also looking in the future into, what we could possibly do to create an online type of electronic pill. And so what that would enable would be communicating between a wearable continuous glucose monitor and the pill to potentially enable a ingestible insulin pump instead of an insulin pump that you have to wear on the outside of your body. And this is really in the works right now and something that we're excited about, but it's still in the prototyping stage.
Wow, an ingestible insulin pump. Phenomenal. I can't wait to see it. I just love my job. Don't you love your job, Alex? That you get to live at the forefront of doing. I mean, you're doing the heavy lifting. I just get to hear about it, but it's like it just lights up my day to hear about how we're moving humanity forward and actually making these life-saving treatments a little bit more manageable for the human condition, right? To make it more seamless, more, I don't want to say part of our day to day, to make it almost invisible as a course of action for us. It really is a game changer.
Yeah, it is really exciting. And, I love this combination of chemical, mechanical, electrical, and biomedical engineering. This interface, it's very new. And this is really the time to have a lot of innovations in this area because the material science that's been being developed for the past 20 or 30 years has brought us to the point where it's very easy to fabricate prototypes of these systems. And so, now we're at the point where we can actually go and understand what it means to interface a lot of these devices with tissue in new ways.
Yeah, just breathtaking. Amazing. So Alex, I typically end these conversations by putting my guests on the hot seat for a moment and just to ask you a question. So, or a couple of questions. So, what do you think, given your vantage point in science, what do you think is some of the one of or a couple of the greatest innovations in the history of humankind? What strikes you?
Well, I mean, I would say insulin, the isolation and the purification of insulin was a huge accomplishment for the medical field. I mean, patients who suffer from diabetes, that percentage of the population keeps on growing. Insulin allows people to manage their diabetes much better than they would with any other type of medication. And so, one of my goals is basically to try and get a lot of these drugs that have been developed, which are truly life-saving drugs, and make them easier for patients to take and make it so that they have a higher adherence rate to them and that there isn't this barrier to entry associated with the stigma of injections and other types of delivery methods. And so I really think that there's been a huge boon in drug discovery, and I'm really building up that in the drug delivery area.
Fantastic. Okay, so that's question number one. Question number two is, what innovation team in the history of humankind would you have liked to have been a part of?
That's another good question. I think that there have been a number of really exciting teams. One of the ones maybe that happened very recently was the AlphaFold at DeepMind and solved protein folding to a pretty significant degree. That was really shocking to me. The ability.
What is protein folding for the rest of us who don't know?
Yeah, so there's been this problem that has been, tackled by scientists and professors around the world, the ability to understand a way that a protein folds itself after it has been translated, built in different amino acid components. And so depending on those amino acid components and the way that they're ordered, the protein will fold in a specific way to have a specific function. But it's been really difficult to guess how the protein is going to fold. And DeepMind and AlphaFold and Google had a massive team of people and worked for many, many years on creating a machine learning algorithm that solves that problem with an equal to or greater accuracy than the imaging techniques that are being used right now. So that's really exciting. I mean, I was really impressed with their results, and they continue to come out with some really exciting results as well that builds off that.
So, and my last question is, if all of us have like pet peeves or this deep desire to see an innovation that doesn't yet exist in the world, what would you love to see or something that's driving you nuts that you wish somebody would fix in your world right now?
Yeah, so I see, one of the major pain points that I see is, in this field of drug delivery and bioelectronics, because that's where I work in, and creating new ways to target areas of the body that are traditionally very difficult to target. In particular, I think heart disease is, a disease that is being left behind in a lot of this innovation space for drug delivery, just because it's very difficult to get drugs to the heart. If you're injecting them, if you're ingesting them, it's just been very difficult, especially for macromolecules, for these large molecules, to get into that heart tissue. And so that's something that I would love to see have a major piece of innovation done in the near future to help prevent patients who get myocardial infarctions from having heart failure.
Wow. Yeah, it's so critical. And I didn't know that the innovation on that front was waning. So we'll have to have some breakthrough cardiologists on to talk about the research that they're doing and see if there are things in the works that maybe we don't know about just yet, but that would be amazing. Well, Alex, thank you so much for sharing all of your inventiveness and innovative approach to changing how we think about healthcare and solving these really critical health challenges for us today. Thank you so much.
Absolutely. I'm happy to chat.
Great. And so if you want to follow Alex's research, Alex, where can people learn more about what you're doing?
Sure. They can follow me on Twitter, which is at AG Abramson, Abramson. You could connect with me on LinkedIn. And then I also have a website that you can go to learn a little bit more about the research that I'm doing, which is www.agabramson.com.
Fantastic. Alex, thank you so much.
Yes, thank you.